I think something that you're obviously shining a light on is the idea that it's not a simple story that pleasant touch is always pleasant. We've talked about the fact that the brain can mix things up a bit and make what could be a positive stimulus seem very unpleasant. Similarly, I think it's true that there are some people who have different levels of sensitivity and indeed a different level of need for so-called affective touch. For them, it isn't necessarily pleasant. Can you tell us a little bit about that?
The defensiveness to touch. There's certainly gradations of that. I would assume even within the autism spectrum, there will be gradations of that. And there's certainly a hypothesis that that defensiveness or aversion to touch, to slow, gentle touch, not necessarily to deep pressure, but to slow, gentle touch, that aversion comes from a dysfunction of the C-tactile system. It's a hypothesis that suggests that the C-tactile system has a developmental role, that it's not just about signaling pleasant touch, but has a very critical role in how we, during development. And so that's where the CT and autism, I think, have an interesting potential link. And indeed, there are several other conditions like that. A subset of patients with Tourette's syndrome seem to report defensiveness to touch, and indeed several chronic pain conditions. It's a very common symptom. The relationship between how much we want touch and how, so the relationship between a desire, our want for touch, and how we perceive touch. I am not sure how clear that is, but at least in the context of aging, there might be other studies as well, but at least in the context of aging, it has been shown that as we grow older, we find touch to be more pleasant. And that's thought to be an increased desire to want touch. One could infer from that maybe for some elderly, they don't receive enough touch, tactile stimulation, and so the weightage given to a tactile stimulus increases with aging.